Hi everyone, so today we're going to be talking about Lyme disease from the neurologic perspective. So Lyme disease is caused by a bacteria called Borrelia burgdorferi, and this bacteria is gram-negative, it's a spirochete, and it's found in ticks, and ticks bite humans and transfer it on. And these ticks are found typically in north central or northeastern US, as well as southern Canada and Ontario, especially Quebec, BC. And Lyme disease typically presents in three clinical phases. So early localized, early disseminated, and late disease. In an early localized, this is where, within the first month of infection, you're gonna start to see in 80% of people this sort of target rash, bullseye rash, otherwise known as erythema migrans. And in terms of other features, you can see these sort of non-specific features such as fatigue, malaise. You can also get like a mild headache or neck stiffness. Also get constitutional symptoms such as fevers, chills, that kind of thing. Early disseminated is where you see the neurologic complications, but it's sort of the timeline is first few weeks to several months. And you're going to see more commonly, though, migratory arthralgias. And you can more rarely see these sort of cardiac complications that are associated with Lyme, AV node block. You can also see mild pericarditis as well as cardiomyopathy. And in the neurologic perspective, there's cranial neuritis, which especially cranial nerve 7, facial nerve as well. You can also see radiculoneuritis. So that's going to present like in sort of like a painful paresthesias in a certain dermatomal distribution. And for the cranial neuritis, if, for example, facial nerve is involved, then patient presents with facial droop, let's say on one side with the lower motor neuron pattern to it. And then more severe cases, you can get meningitis, as well as encephalomyelitis. And so in late disease, you can see an arthritis, mono or oligoarticular, and especially in the knees. You can also see a mild encephalopathy. From the neurologic perspective, as well as there's like more rarely like a subtle axonal peripheral neuropathy as well. But I think these are the main takeaway points in terms of key points for neurolyme. Investigation-wise, serum ELISA of Lyme is where you start, and then confirmation-wise, you order a Western blot, getting an IgM and an IgG antibodies, and then in terms of other investigations for meningitis and encephalomyelitis, you're going to have to rule out other sort of causes for infection, right? So you get an LP and you're going to send off and you're going to check the white count and all that. So you're going to expect in neurolyme to see a lymphocytic pleocytosis. It's got to be at least greater than 5 typically, and also an elevated protein, CSF protein, usually 1 to 2, not typically greater than that. And of course, you're going to send off anti-Borrelia burgdorferi antibodies from the CSF, and then there's also like cross-reactivity with syphilis and Lyme, so you might send off a VDRL as well. And then in terms of imaging for meningitis and encephalomyelitis, you're probably going to want to get an MRI brain with GAD. For encephalomyelitis, you'll probably see, you can see like these multifocal intraparenchymal lesions, and then also with cranial neuritis, you can also expect to see enhancement of the cranial nerve that's affected. With radiculoneuritis, did not mean to do that. Let me just correct that very quickly. So for radiculoneuritis, you probably want to consider getting an MRI spine with GAD at the level of the nerve root that corresponds to whatever dermatomal distribution their paresthesias are. So, and you'll expect to see again enhancement of that nerve root. So yeah, that's pretty good for investigations. The treatment is pretty simple. You're going to give an antibiotic for a bacteria, right? And the one antibiotic of choice is doxycycline. You usually give it for 10 to 14 days, up to 28 days. And this is given orally. And then an alternative is IV ceftriaxone. And and you might consider using that in more severe cases, like in meningitis or encephalomyelitis. But yeah, so yeah, I think that's a good summary of NeuroLyme. Hopefully that was helpful. Thanks for listening.